Dr. Julia Carroll, the Director of Dermatology here at Medcan, is known for her ethical and natural approach to beauty and subtle but effective rejuvenation treatments. You may recognize her face. She's a frequent guest on ET Canada and the Global Morning Show. She is also a lecturer at the University of Toronto and a consulting dermatologist for L'Oréal Paris, Canada. Dr. Carroll is an active member of the Canadian Dermatology Association, the Toronto Dermatologic Society, the American Society of Dermatologic Surgeons, and the American Academy of Dermatology. And she is also on staff at the University of Toronto Medical School, where she finished her dermatology training. She earned her medical degree at Dalhousie. Dr. Carroll, I will now pass it over to you.
Thank you. So when we look at this photo, there's two things you're probably thinking. You're thinking, this is the Holy Grail. I want to go from the right to the left. Or you're thinking, oh gosh, how do I prevent myself from going from the left to the right? So we're going to get into that tonight. As dermatologists, we always like to categorize things. And when we look at the aging process, we call it the 3 Ds. So we have deterioration, deflation, and descent. And pretty self-obvious terms. But tonight, the products we're going to look at are really focused on that area of deterioration. So how can we prevent, or how can we turn back time on some fine lines, some wrinkles, some texture change, and some pigmentation? So we're all concerned about this. Then if that's true, or at least those of you who signed on tonight are concerned about this, so why aren't we all on a skincare routine? And when I took a look at this, these are the things that sort of, that came up to the top for me. So I think it's a very, very confusing topic. There's a lot, it's time consuming to dive in and sort of say what is actually working. There's a lot of marketing pressures. Every company is telling you that they have the best product, this is going to turn back time, this is like Botox in a bottle. And so that results in a lot of wasted money and a lot of unsatisfactory results. So you put the time in, you started using a product, you've invested in it, and you're not seeing any results. So then that leads to disappointment on the part of our patients, and also on the part of the physicians as well. And then higher expectations. You've tried something now, you're disappointed. The next time around, you're going to expect a lot more out of a product. So there is a category of products called Cosmeceuticals, and really what that is the marriage of cosmetics, which is products that are designed for beauty. So these are things that will improve color, that are really part of adornment, lipstick, foundation, things like that. And then on the other end of the spectrum are pharmaceuticals. So these are drugs which therapeutically alter the skin's physiology, or they reverse a disease process, and that's a very specific definition. And so the marriage of cosmetics and pharmaceuticals is a term called cosmeceuticals, and it's not an official term, it's just one that sort of has evolved within the industry to bridge between products that are used for beauty and adornment and products that are technically drugs, and we're trying to find that middle ground. And so usually they contain at least one distinguishing or star ingredient, and they commonly claim to improve things like skin function or tone or firmness. So I want you to take a look at this slide. Take a minute, and I want you to think about which of these words do you think actually mean something, is actually relevant when you are shopping. So take a look. Is it natural? Is that what's important? Is it Health Canada approved? Maybe you think dermatologists tested. The truth is, none of them mean anything. So they are words that are used on bottles. Natural doesn't necessarily mean it's better for you or worse for you. I always tell my patients that poison ivy is natural, and after a summer of cottaging, no one likes poison ivy. Organic is a word that comes from the agricultural industry. It really doesn't have a specific place in skincare. Health Canada approved, or in the US, FDA approved. The Health Canada in the world of products that you would apply to your skin, they only get involved when there's a safety concern. So because if it's approved, it means it's safe to use. It doesn't mean it actually does what it says it does on the bottle. And dermatologists tested, again, it may have been dermatologists tested, and I've done some of that work for some companies, but it's not a regulated term that specifically means anything. So that goes back again to this is a confusing world, and how are you to know where to turn? So if I said to you, what's your preference? If you're purchasing a product, are you looking for something that decreases wrinkles or something that decreases the appearance of wrinkles? I'm going to guess that what you want is something that decreases wrinkles. But here's the thing. We'll go to the next slide. This is wordy, but any cosmeceutical that claims to significantly alter the function of the skin, remember we talked about this at the beginning, is considered a drug. And if something is a drug that is required to go through all the FDA, Health Canada approval processes, just like any other drug, whether it's for heart disease, diabetes, cancer, they have to prove efficacy, they have to have large trials, double-blind controlled trials. So when you think about this, then you think about the companies that are producing these products that are over-the-counter, they can't make claims. It's in their best interest to be ambiguous, because once they make a claim or once they have evidence that there's a claim, then they have to go through this process. So, I've seen studies, and we'll get into some of the products that I think actually hold weight, but the companies keep them pretty close to their chest, because if they publish these studies, then all of a sudden these become drugs, and they're not going to be available in the local Shoppers Drug Mart or Rexall. So it puts consumers in a bit of a difficult situation, but that's the truth. And then when we look at the evidence supporting these cosmeceuticals, where does this evidence come from? Because as a physician, I'm really big on evidence and showing me sort of like, where's the money? So there are lab studies. A lot of the lab studies come from what's called in vitro, which means they proved in a petri dish that it had an effect on certain types of cell, but they're not in vivo, which is what happens in a human body. Some of them are stolen from burn and scar literature. The assumption is that some of the wrinkles that we see are damaged skin, just like burns and scars. So if we use some of the evidence from burns and scars, maybe we can improve just normal aging and sun damage. A lot of the studies that are out there are small patient numbers. You even see, even worse, just isolated study photos where a company will say, look, this patient A, they look at them 4 weeks later, don't they look better? And there's a lot of subtleties. If you hold your neck one way and the other, we've all done it taking selfies, you can look better in 1 second. And then there's anecdotes, wow, this patient, used this kelp from California, and then, they looked so much better, but that's just one patient and one story, and again, where's the evidence? So you have to be a bit skeptical. So today what we want to do is we're going to give you a clinical approach. It's going to be based on the evidence, and then we're going to go through a few special cases where we may deviate slightly or add in some extra ingredients, and we're going to cover a few myths as well at the end if we have time. So this is the way I look at skincare in my day-to-day practice. So I look at daily essentials, then the need to have, and then the nice to have. So let's start with the daily essentials. So no surprise, sunscreen is at the top of my list, followed by a category of products called antioxidants. Now, this is a bit of a crazy slide, but I want you to focus your attention on the right-hand side and that big burning orb called the sun. And really that's where the majority of aging and sun damage comes from. We call it photoaging. So in terms of the things that come from the sun, we have ultraviolet B, or UVB, ultraviolet A, or UVA, and then infrared, which is really the heat that comes from the sun. So what we're looking at is sort of these things, right? These things attacking the skin. And you can say that on the right, by the arrows, is the sunscreen protection level. And everything is still getting through to some extent, except for the ultraviolet B, which it does a decent job of blocking, and a little bit of the ultraviolet A. So now we're going to take a look at what are some of the things that sunscreen does. So I think by far sunscreen is the most studied, the most documented, and actually scientific proven anti-aging product that we have. So we know that it reduces your risk of sunburn from the ultraviolet B. It reduces the accumulated sun damage that you can see, and there's actually, with the new labeling on sunscreen, a lot of them have anti-aging claims that they're allowed to put on the products if they're an SPF over 30 and they're broad spectrum. And then we also see that they're reducing visible lines of aging caused, again, by UV, and so you'll see decreases fine lines and wrinkles. But what does sunscreen not do? So there are a few weaknesses for sunscreen. So it's not 100% effective. So SPF blocks a certain percentage of UVB, and even less UVA. So what do we think that number is? Does it block 50% of the UVB? Does it block 75% of the UVB? It's actually 98% of the UVB. Okay, so that's great. But so why do we want any more than a 45? Well, that assumes that you're going to apply that amount. And most will only apply about a quarter to 50% of the recommended amount. So now you've got less sunscreen than you need to get to that 98, so you're already getting more sunlight through. And the other thing is that number 98, or think in reverse of the 2% that's getting through, it's like a bucket. So that's 2% getting through every second, every minute. So all day long, you're filling up this bucket of ultraviolet damage, which is why we tell people to reapply and use things a little bit higher than you may assume that you need. And the other interesting thing, and this is becoming a topic that we're studying a lot more, is that half of the sun's energy arrives on Earth as infrared radiation, as heat, which we also know does damage to the skin. It penetrates deeper than ultraviolet, and it does cause some of the products called free radicals that can accelerate skin aging. So, sunscreen itself is just not enough. So again, we'll take a look at my crazy slide. So we've blocked some of the UVB, we've blocked some of the UVA, but all these other things are getting in. So cigarette smoke, air pollution, ozone, oxygen itself can be damaging to the skin, and infrared, which is heat. So these things enter into the surface of the skin, and then they cause something called free radicals. And free radicals are these little, you can almost think of them as like little damaging spheres that bounce around inside the skin, and they create damage to the skin. And then when they get inside the DNA level, which is those little helixes that you see, they can actually have an effect on the skin, which can damage the DNA, and then that's where we start to see long-standing sun damage and as well as some skin cancers. So it's not enough. So then we turn to a category called antioxidants. And what antioxidants do as a category is they scavenge these free radicals that were caused by all the assaults to our skin. So some of the more common ones are hydroquinone, vitamin C, coffee berries getting a lot of press these days. Coenzyme Q10 has been around for quite a while, but it's standing the test of time. Green tea is an up-and-comer, and vitamin A is a antioxidant. It has a number of different actions, but it's an antioxidant as well. So I want to focus on, I think the two with the most evidence are hydroquinone and vitamin C, but I really want to focus down on to vitamin C because I think that's the most interesting story. So vitamin C has lots of different forms, so ascorbic acid, ascorbyl, phosphate, you can read them there. By using the little channels we create with the laser and then putting the vitamin C on, so we're getting a really nice large hit of vitamin C into the deep part of the skin. And then I think also what's good to know is that you need vitamin C as a cofactor to actually make collagen. And we're all about making more collagen. So not to get into the nitty-gritty of the studies, but again, this is a product where we do have some good studies. They did studies where they applied vitamin C for 12 weeks, and they showed that there was a reduction in wrinkles. And then another study was done, and they actually had histologic improvement. So they actually did biopsies and looked at the skin under the microscope, and they had an improvement in the skin texture and the skin collagen. So then we're back to the picture again here. So we've got our sunscreen, which gives us decent protection, and then you see the little purple. They almost look like little Pac-Mans, and that's our antioxidant. So again, we know that we get 98% protection from ultraviolet B, but I have to say I discovered my first age spot on the back of my right hand this week, and so I'm more than ever committed to doing everything I can to prevent this type of damage going in. So what I like to describe to my patrons when they say, well, how do I know which one to use? Well, basically, when you think about antioxidants and you think about sunscreen, it's like putting on a coat or putting on a sweater and then putting on a jacket. It's a double layer of protection, and I think it's worth it. So then moving on to the next category, so we've talked about daily essentials, and now this is the need to have. So these are things that don't just protect your skin, but might actually transform your skin and make some changes. So the two that we'd like to look at are alpha hydroxy acid and a category called retinoids. So when we look, so this is like going, this is med school 101 for all of you out there. This is a biopsy of skin or a facsimile of a biopsy of skin. So when we look at this is photo damaged skin. What we see is the top layer, so this is the skin is on its side. So the part of the skin to the right is the stratum corneum, or the very surface of your skin. It's disorganized, it's rough. When light hits that skin, it's not going to bounce off. You're not going to have glow. And then we see the little areas along it that are pigmented. So the skin is spewing out pigment. It's not doing it in an organized way, and that's what you're going to see as sunspots. So when you look at alpha hydroxy acids, what do? So they're usually the ones that we go to are lactic acid, which is a milk-based acid, and glycolic acid, which is a fruit-based acid, actually from sugarcane, which is why you see that little picture in the corner. So the interesting thing about alpha hydroxy acids is they have two ways that they can improve our skin. They're actually a moisturizer, and at the same time, on the right-hand side, they're an exfoliator. And so if you're looking for gentle exfoliation, but you still feel like you need hydration, alpha hydroxy acids are a great product, and they're a great starter product that we like to use for people who are looking to improve the early signs of aging. Also, it's great for acne, so if you have acne and you're also wanting to get on the bandwagon early, this is a great product. So in terms of moisturization, what it does is it actually increases the hyaluronic acid in the skin. And that's the same thing that we'll inject into skin when we do injectables, but it's found naturally in the skin. So it increases the amount of hyaluronic acid that you see there, and hyaluronic acid absorbs tons of water. So you're going to see in the photo what that looks like. And then exfoliation. So instead of having that rough skin along the edge, it's helping to exfoliate, and you get newer, more orderly skin. And again, there are some studies. This comes from a study based out of England, I believe. And I'm going to show you more in a photo type way. I think it's a bit more clear. So you'll see the one on the left is the photo damaged skin. The one on the right is the skin that was treated with alpha hydroxy acid. And again, it's smoother. It's increased the thickness of the epidermis, so the cells in there are thicker, more plump, and that's that hyaluronic acid that it's holding on to. And also the pigment-making machine, the melanosomes that are in there, they're doing it in a more organized manner. So it's not these little clumps. It's just a steady, nice stream of pigmentation that we naturally have, occurring in our body. Okay, so the next category is retinoids, and really this has been the skincare go-to ingredient for 30-plus years. I would say that this has probably kind of launched the whole concept of cosmeceuticals. And so retinoids are a derivative of vitamin A, and they occur naturally in the skin. And there's, again, lots of different formats, which makes it confusing. There's retinol, retinol palmitate. You can see the list that's there. Finally, leading up to tretinoin, which is our prescription and often referred to as Retin A. But there are lots of brands, but Retin A is sort of the one that we all grew up knowing. And the strongest evidence is for that prescription product called tretinoin. But again, just like the vitamin C, it has some stability issues. So it doesn't do well in light. It doesn't do well in oxygen. So what is it that the retinoids do, and why do we love them so much? So in the way they actually came to being a staple in the anti-aging world is they were originally on the market for, and still to this day are on the market for, acne. And so all the teenagers were using it, and then the moms started to steal it. And they couldn't understand why the sales of Retin A had gone up so high. But it was the moms were kind of getting wise to the fact that this was improving skin texture and tone and quality, and they were stealing their kids' acne medicine. Mm-hmm. So in terms of what the Retin A actually does, it acts in two different ways. So it acts at the genome level, so at the level of the genes, and it binds to receptors that are specific to retinoids in the nucleus, and it basically prevents, there's something called, this is kind of getting very technical, but matrix metalloproteinases, and what they do is they break down all the elements of your body. So your body's always making things and breaking them down, and matrix metalloproteinases are what do that. Now, when you're in your 20s and you have a bit of a baby face, maybe you want to be breaking down a bit more of that collagen than you want to be keeping. When you're in your 40s, you're not making as much, so we want to hang on to everything we've got. And so what this drug does is it actually goes into the genes, into the nucleus of the cells, and it prevents some of that breakdown activation. And then it also acts outside of the center of the cell as well. So it is actually a UV filter, and it's something that you'll see in lots of sunscreens. It can be antibacterial, and it also works in combination with hydroquinone, and it can help to decrease pigmentation. So when we look at the clinical evidence, there are lots of trials, again, in the retinoid category. So there was a trial that was done with 125 patients for 12 weeks, and they found that it significantly reduced the appearance of wrinkles and of hyperpigmentation. And then they did an even more in-depth study where they did retinol versus a vehicle, and I don't know how they paid these people to do it, but they got them to put it on their arms for 24 weeks. One arm was one product, one arm was the other, so one arm the active ingredient and one arm just a cream. And then they actually did biopsies on them after the 24 weeks. It must have paid them a lot. And they found that it increased something called pro-collagen. So that's the product that you get, and then it gets that the body makes, and then it's cleaved and turns into collagen. So it's pretty compelling. So a lot of that evidence comes from the tretinoin, which is the prescription. So how does that stack up to the over-the-counter retinoids that we have? So again, strongest evidence is definitely for the prescription product. We do have some trials for the over-the-counter products. A lot of the evidence that is given to the over-the-counters really is based on the prescription products. But some of the things we know that in order to be effective, an over-the-counter retinol does have to be at least 0.3%, and then they only go up to as far as 1%. And the interesting thing is that a lot of these products that are retinoids or that are not the prescription one, what actually happens is they get converted in the skin to a tretinoin. But we don't always know how much and how often. So it is a lot of extrapolation that's going on there. But having said that, when we look at, again, our slide of the damaged skin and then the new skin, this is a now skin that's been treated with both the alpha hydroxy acid and the retinol, we see that not only is the epidermis looking better, the blue part, but the pink part below is also looking better. That's the dermis. So it's thicker. The supporting area called the reedy ridges are higher. The melanocytic cells, the cells that make pigmentation, they're working better, and we have more fibroblasts, which is sort of the factory in the skin. So the next one is the nice to have, the kind of icing on the cake. This is if we're looking to really optimize the skin, and we're sort of getting into the territory of we're not quite sure, but if you want to give everything you've got, I think this is something we should go for. So peptides and growth factors. So again, one of my crazy doctor slides. So if we look at this is basically the inside of a cell. And when you think about your body is basically runs on protein. Protein is the currency of your body. So if you look far out to the right and up at the top, there's something there that's called EGF. That's an epidermal growth factor. So that's something that is found in the skin, and when it goes inside to the cell membrane, into the wavy apparatus that's there, it turns on production of collagen. And then if you also look on the right-hand side, there's sort of the purple worms that are there. That's collagen, and as I mentioned before, collagen will break down slowly, whether it does it naturally, whether it's because of damage from the sun or injury. And what happens is that breaks down, and there's a little part of that's called a peptide, which is basically just the garbage left over. And that peptide goes into the cell and says, hey, look, I'm a piece of collagen and I'm broken. You need to make more of me. And so it goes in through that big apparatus, and then it spits out more collagen. So Specifically, and I wouldn't write these down because they're not things you're going to find on the back of the bottles, but I just wanted to talk about some of the peptides that we are looking at, and some of them have commercial names, and a lot of the companies, they won't tell you exactly what peptide is. They're proprietary, so they kind of keep it to themselves. You know, they'll call it a special name like a Medcan, and then they won't tell you what it is. But so basically, we don't have one of those. I'm just joking, but. So it stimulates collagen production in vitro. So again, that's in a dish, not in the body, but it is quite potent, and you don't need a lot of this particular one to see some activation in the Petri dish. There have been some human studies that have shown improvement in wrinkled skin, and the nice thing about this one is it's well tolerated. And then this is another one that, again, it stimulates wound healing in the lab setting. It's not as potent, so you need a bit more of it. And there are a series of papers for this particular one that showed it did improve skin thickness, it improved hydration, and it did smooth wrinkles. And in this same category are some of the molecules that some of the companies claim are Botox-like, but I don't think the evidence is there yet for anything that's going to actually affect movement in the skin. Again, I think if that was shown, then it would be a drug, and we do have that drug, and it's called Botox. And then growth factors. I thought you guys might be getting bored of all the science, so I put this little beefy guy here on the right to distract you, but so there are some candidates for growth factors. So there's the epidermal growth factor, which is the one that we saw on that big crazy slide up at the top. There's fibroblast growth factor, and the theory, again, is that these growth factors, they come to the evidence in the womb. So in the womb, there's a lot of things that happen to babies, but they come out pretty much perfect for the most part. And they have this scarless wound healing that happens. And so even sometimes there'll be biopsies that are done in babies in utero, when like through a pregnant abdomen, you can do a little biopsy of skin, but these babies come out and you don't see any evidence of where these biopsies were done. So they looked at what's the milieu, what are the growth factors that are around at that stage, and they extrapolate from that. And then, you know, the growth factors, it kind of assumes, again, that the aged and the photo-damaged skin is acting much like wounded skin. And so there's a bit of an extrapolation there. But I think these two categories of peptides and growth factors are probably where the next big leaps are. So I think if you're someone who wants to give it everything you can, then I would add peptides and growth factors in. I'll just go back to the back one. And then I just think it's important to talk about stem cells because it's a big buzzword in the world right now. So if you were to think about stem cells, you probably, you know, if you have a concept of that word, you would think, well, that's great because this is a stem cell. This is where all the other cells come from. So if I can put stem cells on my skin and make more of everything, that's great. But when you read about stem cells in skincare, they're actually not exactly that type of cell. For example, there's products out there that are apple seed-based stem cells, but they're actually acting more like little factories. They come from the apple seed, and you know the apples have antioxidants in them, which we love. And so basically, that stem cell is just making more of that apple-based antioxidant. It's not a human cell. So there are some human stem cells that are being looked at. They promote some collagen synthesis through fibroblasts, but again, I think the evidence is not quite out there. But I just want everyone to know that when you see stem cells in a product, it's probably not or shouldn't be a human stem cell. And if it is, it's probably not doing anything because the sort of environment that those stem cells need to live and produce what they need to produce is not possible at this point in a cream. All right, so let's look at some special cases to consider because not everyone's skin is the same and there's certainly not a one-size-fits-all approach to what we do. So we're going to look first at redness and sensitivity. This is rosacea could fall under this category. So things to keep in mind, I think you should really go for a cream-based cleanser, something that's really gentle. If someone in this situation, I would avoid toners. I think there's some things you can look at, moisturizers with something called Panasol in them. Zinc and titanium-based sunscreens will be less aggravating than some of the chemical-based sunscreens. Green tea is thought to be very soothing, and it's an antioxidant, so it's going to battle against some of that cell damage. And there's a prescription called bromonidine or on Reltia, and that can be really helpful for calming redness. So in terms of the key ingredients to look for, panathol, which is a vitamin B5, zinc and titanium, and then green tea, which is an antioxidant. And then moving on to dyspigmentation, or the pigmentation that we don't like. So, sort of past the cute freckles of our 20s. The gold standard in treating pigmentation is something called hydroquinone. And as dermatologists, we use it in combination. We usually mix up a concoction, something called the Kligman's formula, which usually has we may add some vitamin C into that. We may add, we may add it with a retinoid as well. But if you don't want to use a hydroquinone, which that is available without prescription, but there are prescription ones, other things to look for that maybe are a little bit less aggressive would be kojic acid. That comes from a mushroom. There's azelaic acid, which is a prescription, but again, not quite as strong as a hydroquinone. And then we often combine those products with glycolic acids or retinol just to try to improve the penetration of those products. So if you're concerned about pigmentation, things to look for would be hydroquinone, kojic acid, and then we also want to add in a glycolic or a retinol. And the next thing is oily skin. So cosmeceuticals, it's important to know they can remove oil, but they can't really affect the production, because again, then they'd be a drug. And even then, I don't actually know a drug that does that, with the exception of some oral medications. But things that can help are cleansing with a salicylic acid cleanser, witch hazel-based toner can help sort of degrease. Niacinamide can be found in moisturizers, and that's helpful for decreasing oil production, or increasing oil absorption. And then retinoids as well can also be helpful to break up the oil that's on the skin. And then sometimes really just going back to old school methods like facial powders and oil absorbing papers can really be helpful. So we're looking again for salicylic acid, witch hazel, niacinamide, and retinoids. And acne. I think it's really important for everyone to know that acne is not just a disease of the teenager, but they say 30% of women over the age of 30 do have acne. So for some people, it's new in their 30s and 40s, and for some people, it's persistent. They've had it since their teens. So if you do have acne, over age 30, it's not surprising and it's not unusual. It's definitely irritating, but it's not unusual. So, and we can help with that. So in terms of the things that you can start with, comedones are blackheads. Basically, it's the starting point of all acne. So we want to clean out that pore essentially. So salicylic acid and glycolic acid are great for that, and the retinoids are also very helpful. In terms of reducing oil and inflammation, sort of the redness associated with acne, niacinamide is great, and in terms of being anti-inflammatory, zinc is also very helpful as well. And then, so you can see those lit up there. I think it's also really important if you have acne, you're often using products that are stripping your face, because we've just talked about you reducing oil and exfoliating, but sometimes then your skin gets too irritated and then it's red just from the irritation. So I think it's always really important to have a gentle moisturizer on board as well. And if you're getting prescription products, this will actually enable you to tolerate the prescription products as well. All right, so you're in. You believe me. Now what and when? How am I going to apply all these things? So there is a product order, and this is the order of all the products, but you don't necessarily need all of these things. Again, I think you look at how committed you are, how many products you want to get into. If you can find, products that do 2 or 3 things at a time, I think that's great. And then you may also have, a condition that we're treating medically as well. So it's important to know how to put all those pieces together. So the method or the organization is you're going to use a cleanser, and I want everyone to clean their face, especially at night. Then a toner, if that's something that is required or something that you want to do. Then prescription products would go on. So your skin is primed, you have nothing on your skin, and then we're looking to apply the prescription products closest to the skin so they can be the most active. And then you kind of go from the lightest to the thickest. So serums, then moisturizers, then finally a sunscreen. And then if you want to put makeup on after that, then that's where that would go. And then just to keep in mind sort of what products when, the antioxidants and the sunscreens we want to use during the day. The retinoid products we want to use at night, because remember I said they were sensitive to light. And so other than that, you just make it fit into a routine that works for you. And then looking at myths, we're going to skip right to the products. Okay. So in terms of a product that works, this is one that this is sort of looking at just the 4 basic products. So in this, we have our topical vitamin C, so that would go on first in the morning, followed by a sunscreen. And then we may also want to use a product with a glycolic acid as a moisturizer. Sorry, I put those out of order. That would go before the sunscreen. And in the evening, I try to get all my patients, if they can tolerate it, to be on some type of retinol. So really, you want to keep it simple. Start with just a few products, and then you can add in more if you want to get into peptides and growth factors and even some of those stem cells, that's fine. But start with a routine that you can manage and then add as you go.
All right, well, thank you so much, Dr. Carroll. If we have time, we could go back to the myth slide, but we do have some questions from the participants. Before we get to the questions, I just want to remind you that if you do have a question, you can submit to the area in the bottom of your screen. And so if you haven't already, feel free to write down your questions. And again, the questions will only be seen by the presenters and will remain anonymous. First, I just want to take a moment to tell you more about dermatology at Medcan. Now, at Medcan, we believe that your skin is an outward reflection of your wellness and can be a big part of your inner confidence. Our solutions, treatments, and products are based on medical evidence, as Dr. Carroll was speaking to, and administered by physicians and experts with advanced training. We will work with each client to achieve their skin health goals. Now, the products and services at Medcan include injectables and procedures like Botox, fillers, Velkyra, skincare products, laser hair removal, professional facial treatments, photofacials, non-invasive laser treatments, and plastic surgery consultations. If you'd like to learn more, please visit medcan.com/business or contact us at the phone number on your screen or email us at dermatology@medcan.com. So we are now going to turn to some of the questions. The first question is with regards to darker skin and hyperpigmentation, specifically melasma. What kind of advice would you speak?
Well, that's a great question, and it's a common thing that affects people of all skin types. But I think with my darker skin patients, it can be particularly challenging. The most important thing when it comes to melasma is sunscreen. And people will often tell me that they're using sunscreen, but when I really, dig into it with them, they're not being as careful as I want them to be. So it's important that they're using, I should even back up, not even just sunscreen, but really sun avoidance. And as dermatologists, we talk about, sunscreen is really your third line of defense. So from the sun, the first thing is to avoid the sun altogether. So you're staying out during peak hours. The second thing is to use protective clothing and protective hats. And then, like I said, your third line of defense is sunscreen. So really get my patients into that method of thinking. And it's something that I model as well on a daily basis. Whenever I'm out, if I'm going to my car, even if I'm just going from my car to my office, I'm always wearing a hat, even in the wintertime. And so I think that's really important. So hats on, if you go on that beach vacation, you're under the umbrella, and then you are using at least an SPF 60 on your face. You're reapplying it twice a day. Some of the products I really like from melasma, they come and they're commercially available very easily. They're sticks. They almost look like a glue stick. And so I'll tell people, keep that in your car, keep that by your desk, keep it in your purse. If you pop out at lunch, you don't have to reapply everything, but you're just going to reapply on the areas where you have the melasma. And then, the next sort of gold standard in terms of treating melasma is the hydroquinone. And as dermatologists, we usually do that in combination with topical vitamin C, sometimes a little bit of steroid, and in a retinoid, and that's a prescription that we can make up and customize depending on the patient's sensitivity. And then there are some different laser options that can be effective as well. But the big thing to remember with melasma is that it's never cured. You can improve it, but if you lapse, if you go to the beach, if you forget to wear your sunscreen one day, sadly it can all come rushing back.
Okay, thank you. We have another question regarding department store products versus drugstore type facial products. I think that means maybe more generic, maybe the lower end versus the higher end that you can find in.
Yeah. I think that, again, I think there's some great drugstore products out there that are you don't have to pay a lot of money for. And then conversely, there are some department store products that are probably not worth, you're paying more for the packaging and the advertising than you are for the actual product. So I go back to that slide with the vitamin C, where if you're looking for, if there's a moisturizer that you like and it feels good on your skin, great. I mean, you can choose to spend a lot of money on that or not, and that's fine. But when you're looking for products with active ingredients, I think it's really important to look at the back of that bottle and see what are the ingredients that are listed and are there percentages when it comes to things like retinol or vitamin C, because that's when you'll know if it's worth spending the money.
How about when should someone decide whether to focus on skincare and then the next level, which would be Botox or lasers?
So yes is the answer to that. So, and again, this is my analogy for that. I go back to my sweater sort of jacket. So I'll say to my patients, if you're really serious about either prevention or making a change, reversing some of the sun damage or some of the fine lines or wrinkles that we see, it's like saying, well, okay, I'm getting dressed this morning. Am I going to wear pants or am I going to wear a top? I'm going to wear it all. And so really, they each have a different way of affecting things. So good skincare is really the basis of the texture of the skin and the foundation that's all built on. If you look at injectables, that's where we're dealing more with from movement, volume loss, and lasers. There's so many different lasers that are out there. There's lasers for pigment, there's lasers for blood vessels, there's lasers for skin texture. So my ideal patient would be sort of hitting it at all different sides.
So, and what age would one start using these anti-aging products and also these services that you speak to?
Yeah, so for sure, anti-aging products, I'm using an anti-aging product on my 6-year-old right now. Sunscreen. Right? I know, I had you there for a minute.
Like Botox.
No, baby Botox. No, we're not doing that. But so I think, sunscreen, start with that, and that's the best thing you can do for you, for your kids. And then there's lots, I think when you're getting into your 20s, I usually will start to introduce the glycolic acid to some of my patients. It really depends on the individual patient. And then I also, I ask them to look at their parents and sort of say, like, how did your parents age? What are the issues that they have? Because aging is somewhat genetic. I think 10% genetic, but family habits run hard. So if you were all cottagers, all sailors, you spent a ton of time in Bahamas, Florida, whatever, that's things we need to know, and we want to see how the people that came before you dealt with that type of skin insult. So that may guide us as to whether we need to be more aggressive or less aggressive.
You spoke about prescriptions for Tretinoin, and how does one get one?
So what I do with my patients is sometimes they might have been on it already for acne, and that's fine. We can then just continue it. But it can be a little bit irritating for patients when they first start. So I'll often start them first on a retinol, just to get their skin used to it, and I'll move them up from, let's say, a 0.5 retinol to a 1% retinol, and then if they're fine, then I'll write them a prescription for tretinoin.
Okay. Well, thank you very much, Dr. Carroll. We've covered a lot of topics today, and this seminar will be available at medcan.com under Medcan Insights next week. So that does conclude today's online seminar. Thank you to everyone who did join us, and apologies again for the technical difficulties. We're so happy you were able to stick with us, and good night.
Good night.